Namaskar to all. Welcome to Saffron Educational and Medical Foundation, an opportunity to be your own doctor today.
Hello friends, Namaskar. I'm Dr. Mona from Saffron for Health. Today we are going to talk about the winter disease and the food. जैसे आप सब जानते हैं हर सीजन चेंज होते हैं, हमें अपने आप में कुछ ना कुछ डिटॉक्स करना चाहिए. सीजन के कुछ जो स्पेसिफिक फ्रूट्स आते हैं, वेजिटेबल्स आते हैं, जो सीजन का खाना होता है, हमें वो ज्यादा प्रेफर करना चाहिए. बिकॉज ऑलवेज इफ वी टॉक अबाउट द हेल्थ देन द मोस्ट इंपॉर्टेंट थिंग इज लाइक use seasonal and regional things which are really suitable for your body, which will give you 100% best nutrition and that will be easy to digest for your structure. So today, as I told you, like winter disease, every season changed, we are going to face certain type of acute to chronic disease. As from the Saffron point of view, we always try to guide you the best tips, the best information for your better health. So like that today also, as you know, just the Navratri is completed and Sharad Ritu is just ending. We all know, like in our tradition, we follow the even we celebrate the Sharad Purnima. So if you talk about the winter season, basically see, जनरली जब हम बात करते हैं सीजन की तो बेसिक 3 सीजन्स आती है, समर, विंटर एंड मॉनसून. उसकी भी सब सीजन होती है. तो अगर हम विंटर सीजन की बात कर रहे हैं तो विंटर सीजन मेनली हेमंत और शिशिर ये 2 ऋतुओं को मिला के बनती है. बट एंड ऑफ द शरद, स्टार्टिंग ऑफ हेमंत एंड शिशिर, एंड ये कॉम्बिनेशन जो एक पूरा सीजन का रहता है, इसे हम पूरा विंटर सीजन, एक साइकिल जो रहता है हमारा 4 मंथ्स का सीजन जो रहता है, उसे काउंट करते हैं. तो बेसिकली शरद पूर्णिमा हम सेलिब्रेट करते हैं. देयर इज अ साइंटिफिक रीजन. सी, आवर कल्चर, आवर ट्रेडिशन एंड whatever we are going to follow, they are basically scientific and this is not proved today. बट फ्रॉम द एंशियंट टाइम्स हमारे जो ग्रंथ है, जो वाग्भट है, चरक संहिता है, जो हृदय अष्टांग हृदय संहिता है, ये सारे जो हमारे ऋषि मुनियों ने सदियों पहले जो ग्रंथ लिखे थे, उसमें उन्होंने हर सीजन में क्या खाना चाहिए, कैसे प्रिवेंट होना चाहिए, कैसी हमारी दिनचर्या और ऋतुचर्या होनी चाहिए, उसकी हमें बहुत ही पहले से बारीक इंफॉर्मेशन दे चुके हैं. वो बस हमें उसे ही फॉलो अप करना है. तो अगर हम बात करते हैं विंटर सीजन की, तो ये हम सब जानते ही है कि विंटर सीजन मतलब कि ठंडी की ऋतु. तो ठंडी की ऋतु में एक कॉमन चीज होती है, हर घर में आपको 1 या 2 पेशेंट मिल जाते हैं, सर्दी, जुकाम, कफ, यू नो एक्सेट्रा. सो बेसिकली कॉमन कफ, कोल्ड, फ्लू आर द बेसिक सिम्टम्स, द बेसिक डिजीज विंटर सीजन में होते हैं. बट एक्चुअली इसे हमें सप्रेस नहीं करना चाहिए. द रीजन, ये जो सारी चीजें हैं, दैट इज अ टाइप ऑफ डिटॉक्सिफिकेशन. हमारे शरीर को हर ऋतु चेंज होते होते काफी सारे टॉक्सिन्स इंटरनल जमा हो जाते हैं. तो जैसे हमारी ऋतु चेंज होती है तो बॉडी को भी डिटॉक्सिफिकेशन चाहिए, बॉडी के टॉक्सिन्स को रिमूव करना चाहिए. तो जैसे हम बोलते हैं कफ, पित्त और वायु 3 दोष से हमारी शरीर बनता है. तो ये तीनों जो दोष है उससे रिलेटेड कोई ना कोई टॉक्सिसिटी बॉडी में क्रिएट हो जाती है. जैसे कि ये सीजन में हमारा शरीर अपने आप नेचुरली कफ, कोल्ड, फ्लू, थोड़ा सा यानी कि हल्का सा फीवर, इस तरह के सिम्टम्स से बॉडी में से जो टॉक्सिसिटी है उसे बाहर फेंकता है. तो दैट इज अ टाइप ऑफ टॉक्सिन्स ऑफ आवर बॉडी. तो अगर वो 2-3 दिन के अंदर अपने आप सबसाइड हो रहा है, क्लीन हो रहा है, then there is no need for any other alternative system or modern medications. Let it be. Don't try to suppress these symptoms because they are showing like your body is on a detoxification. So make sure कि ये जो सारे कॉमन कफ, कोल्ड, हल्का सा फीवर है, they are the toxins. Now we talk like recently with the whole world faced the pandemic era, that is the COVID-19. Many of us are really lost someone dear, near and dear, special ones, and many of us try to prevent themselves. Still, there is a breakthrough infection or the reinfection of COVID-19, as the researchers, specifically the research done in the China, they had shown some alarming signs of third waves of COVID-19. So make sure for this season, the winter, the coming winter, we need to take proper care, more hygiene, and need to take more attention towards our health, because it is not compulsion like if you are vaccinated, then there is no need to take more care. There is nothing like COVID-19 again not affect you. No, it's a completely myth. Don't be under that impression. Rather you are vaccinated or not, there are still chances of reinfection or breakthrough infection of COVID-19, and the whole world is on alarming time. Like if you are vaccinated, of course the severity will be very less. Like the initial first and second waves, the pandemic will never come again, but still, always precaution is better than cure. So there is always chances now, specifically for this incoming winter season, to prevent yourself specifically from the COVID-19 third wave. So apart from that, there are other common respiratory disorders, respiratory disease, which may affect your body or health. That is called the respiratory syncytial virus, that is RSV. And the other common disease that you can say the most people are facing during the winter is strep throat infection. So these are the most common infection during the winter that people are facing. The severity may be minor to major, depends on the symptoms, depend how you're treating yourself. One, the most important thing is your immunity, your metabolism. See, whenever we talk about the health, two things are always there: your immunity first, and second your metabolism. They are interconnected. As we know, we had seen in our previous videos also, there is a very strong bond, strong connection between gut and brain. So it is just like that. If your immunity is very nice, definitely your metabolism will not be disturbed. But if your metabolism is low, that also affect your immunity also. These both are interconnected. So whenever we talk about the winter disease specifically, we need to take these two things very clearly: immunity and metabolism. So during this video, many times you may heard these two words continuously repeatedly, because this is the two main you can say we have that दो जो हथियार है हमें बचाने के लिए. These are the two important tools to prevent us from any type of chronic winter disease, right? So generally, if you are suffering from common cough, fever, respiratory disorder or something like that, then the common symptoms that initially you can see is fever, cough, runny nose, cold, body ache, throat pain, throat infection, fatigueness. So as I told you, like if these symptoms are there for 5 to 7 days, don't worry. No need to take any heavy medications. Of course, you need some home remedies straight from your kitchen. Use some natural herbs if it is available and if you have knowledge. So if within 5 to 7 days of period, the symptoms gradually decreases, you are completely okay. The only thing you have to look after is take proper rest. Don't try to suppress the symptoms. Like as an example, if you are suffering from runny nose, that is common cough and cold, don't take any type of medication to stop that runny nose. Body shows its natural symptoms that there is an excessive cough inside the body, so they are trying to throw it out from the body, as in these are the toxins for body, which is not at all necessary, not at all required for the body. Let it be. For that, try to stay on liquid diet more. Always use hot food or the freshly cooked food. Take proper rest. Don't stress out yourself. As far as possible, do some routine exercise and Surya Namaskar. In short, keep yourself warm during the cough and cold. So these are something like winter is a season of cold, ठंडा सीजन है, तो ऑब्वियसली इस सीजन में हमें अपने बॉडी टेम्परेचर को मेंटेन करना चाहिए, हल्का सा गर्म रखना चाहिए. अगर बॉडी का टेम्परेचर थोड़ा सा हायर टेम्परेचर और हल्का सा वार्म जिसे हम बोलते हैं, डेफिनेटली योर इम्यूनिटी विल नेवर ब्रेक. ऑन इन द टेम्परेचर ऑफ वार्मथ our body will maintain a proper level of immune as well as metabolism. So this is very important thing to keep in mind. So basically, if we talk about the immunity, right? Immunity. Generally, those who are on certain type of heavy medications, suffering from long disease or the history, certain type of metabolic disorders like diabetes or like that, those who are facing the HIV infection or something like that, any degenerative disease are there,